How to recognize signs of a dog with a dislocated hip. As dog owners, it is essential to be able to recognize any signs of discomfort or injury in our furry companions. One common injury that dogs can experience is a dislocated hip. Although it may seem like a daunting task, understanding the signs and symptoms of a dislocated hip can help us take prompt action and provide the necessary care for our beloved pets. What is a dislocated hip? A dislocated hip occurs when the ball-shaped head of the femur bone separates from the socket in the pelvic bone. This causes the hip joint to become unstable, leading to significant pain and discomfort for the dog. There are various reasons why a dog may suffer from a dislocated hip, including trauma, genetic predisposition, or malformation. Signs and symptoms. Recognizing the signs and symptoms of a dislocated hip in dogs is crucial in promptly addressing their discomfort. Some common signs to look out for include 1. Limping or abnormal gait. One of the most obvious signs of a dislocated hip is a noticeable limp or an abnormal way of walking. Dogs with a dislocated hip may keep their injured leg elevated or carry it in an awkward position, trying to avoid putting weight on it. 2. Pain or discomfort. Dogs in pain may exhibit signs such as whimpering, panting, or even growling when attempting to move. They might also become more sensitive when touched or petted around the hip area. 3. Limited range of motion. A dog with a dislocated hip may have difficulty moving or flexing their leg properly. You might notice their hip joint appearing stiff or less mobile than usual. For muscle wasting, if left untreated for a prolonged period, the muscles around the dislocated hip may shrink, resulting in a noticeable loss of muscle mass in the affected leg. 5. Swelling or bruising. In some cases, dogs with a dislocated hip may experience swelling or bruising around the hip joint. If you notice the area looking swollen or discolored, it is crucial to seek veterinary attention immediately. What to do if you suspect a dislocated hip? If you suspect that your dog may have a dislocated hip, it is important not to attempt to diagnose or treat the injury yourself. Instead, follow these steps. 1. Restrict movement. To prevent any further damage, limit your dog's movement as much as possible. Keep them confined to a small, quiet space where they can rest comfortably and avoid putting additional strain on the injured hip. 2. Seek veterinary attention. Contact your veterinarian as soon as possible. They will be able to assess your dog's condition and provide the appropriate diagnosis and treatment plan. It is essential not to delay seeking professional help to avoid any long-term complications. Treatment options. The treatment for a dog with a dislocated hip will depend on the severity of the injury. Some common treatment options include 1. Closed reduction. In less severe cases, a veterinarian may attempt a closed reduction, which involves manually repositioning the bone back into the socket without the need for surgery. This procedure is usually performed under general anesthesia. 2. Surgery. In more severe cases, surgical intervention may be necessary. The surgery aims to stabilize the hip joint and prevent any further dislocations. Various surgical techniques may be used, including the femoral head ostectomy, removal of the femoral head, hip replacement, or the use of implants to hold the joint in place. 3. Rehabilitation. Following any treatment option, physical therapy and rehabilitation are crucial for your dog's recovery. This may include exercises to improve strength, flexibility, and range of motion in the affected leg. Conclusion. Recognizing the signs of a dog with a dislocated hip can help prevent further injury and alleviate their pain and discomfort. Remember to seek veterinary attention promptly if you suspect your dog may have a dislocated hip. With the right care and treatment, your furry friend can recover and regain their mobility, ensuring a happy and healthy life.